It's good to be here. And I wouldn't miss any of these events ever unless something catastrophic would stop me. I only missed one of the events because I didn't know anything about it, the first one, and never missed it since. The reason for that is every time I come, I'm more energized, I learn more, and I'm becoming better and better doctor than I ever was before. Thank you. And so I'm going to, the one thing I wanted to emphasize today is about the non-surgical decompression, the follow-up with supportive care. How do we do supportive care? Our supportive care is 89% retention. 89% of our patients who get decompression or neuropathy, they follow up supportive care. I have patients that are on their 5th or 6th supportive care plan, and that's a year full plan, and it's all paid for up front. This is one of the things that Dr. Bard, Dr. Kaplan have drilled in us. You hear Dr. Bard says the one thing. Well, I've been getting one thing every time. I have many of them, hundreds of them, one things. Because you walk out of here learning something new every day you come. This case here is we used VAVAX-D. We used the microlight 830. We used the activator method. And we use therapeutic activities after 12 to 14 visits after the patient's been on the program. The first case I want to discuss with you is 34-year-old male, construction worker, came after a 3-year injury, VAS 8, and we did x-rays, we did an MRI, and L4, L5, S1 all have the protrusions, and so we prescribed 30 visits. He finished 21 of those treatments because after 21, he felt great, and he didn't have enough time to keep coming to get the treatment. He said, "Doc, I am feeling great. I never felt any better, and I would like to stop." I didn't argue with him. I tried to explain to him it's very important, and he stopped. So he would manage. We did over 10 weeks period. When he finished the treatment, was his VAS was 1. And so this is the x-ray when he first came in 2016. And you can see L4, L5, L5S1. There's decreased disc space. So we get the MRI, and it showed the true picture of what's going on with him. And that's how we treated him. Before treatment, that's the picture. 3 months later after the treatment, you can see the difference between, you can see the difference between the space opening just by x-ray alone. So if you don't want to do an MRI post, do an x-ray. Every patient that comes in, we do a pre and post x-rays to make sure that we show to that patients. So he continued care with the manager with conservative chiropractic adjustment because he felt that adjustment is going to help him, and he comes in periodically, and we didn't press on him. He returned in 2019, 3 years later, and with a VAS again of 8 out of 10. So we took a picture of it in 2019, and it looks like the condition had returned back. So he did not have supportive care. He only got adjustments when he felt like it, and he was doing fine until then. Then what happens, we took that picture when he came back in, and it looked exactly about the same where it was when he came first in 2016. So we did 24 visits this time, and we did 12 microlight. We did adjustments over a 10-week period, and his end result from 8-10 to 2 out of 10. So here's the picture of him. We took the picture when he initially came in 2016, and on the right you see that 3 years later without follow-up care. He did not want to do follow-up care. And you can see it's about almost the same. There's not, the condition came back. And that's a key things to tell the patient upfront in the beginning, the very first report of findings. We tell them, if you don't do that, most likely you will come back and it'll be the same and perhaps worse. So they need to know that up front. So we took that. Then 1 hour later, I decided to be brave. I said, I want to see if that treatment, when he came out on the same day, made a difference. So I took a picture of it. 3 years later without support, and look at the treatment 1 hour later after decompression. What do you call that? That's powerful. When he looked at it, his mouth dropped. He said, wow. Yeah. That is so important to show that patient. Usually family members, if they're there, they are surprised. They're amazed how the difference is between just one treatment. The next case is a 40-year-old male. He's a software manager, always on a computer all day long. He came in with a 6 out of 10. And we did the x-rays and the MRIs. And we see C3, 4, 5, 6, and 6, 7. You see, here's the we did 30 visits. And we did 15 microlight, chiropractic adjustment only as needed, and with therapeutic exercise after halfway through the treatment as they show improvement. And by the time he was done, he was VAS ending at 2. Currently, this guy is on his 3rd supportive care plan. He followed the instruction, and he did exactly what I told him. He doesn't miss a month. He comes in, gets it like clockworks. His VAS currently is 1 out of 10. And this is the picture we took of him. And you see the x-rays shows a slight decrease in disc space, military neck, we call it, right? And we would have adjusted that person, except the symptoms were showing differently, so we took an MRI. And the MRI showed the true picture as compared to, if you look at the x-ray here, it's not too bad. There's not a whole lot of degenerative changes, slight, but here's the true picture. And after we treated him, this is the picture of him when he came in 2018, and this is on the left side. And before, in September, I decided I want to see how far he's come and how is his disc spaces pan out. And I took a picture of it, and you can see the difference, the big change. He maintained the progress because he stayed in a supportive care plan. Supportive care plan is so vital. 89% of my patients are recurrent, taking the supportive care plan. It added, Sally, correct me, it added, I think, $98,000 this year alone in supportive care plans. $98,000 extra because they take the supportive care. Yes, sir. I'm sorry? It typically is once a month, but sometimes patients, they say, you know what, I don't want to wait till a whole month. I want to come back every 3 weeks. And we do that sometimes every other week. And they have a supportive care for a lumbar, supportive care for the cervical. And when it's time to go, they sign up. There's no question about it. So how do you present the supportive care plan? It's not a cure. We have to tell the patient this treatment is not a cure. It's not going to bring you back to 16 years old. The damage is done. It's a dry, rotted tire. And if you can't replace it and you can't plug it, you're going to have to add air to it. That's what that is. Supportive care, maintain the progress. The treatment, the main protocol is to help us reach the maximum benefit in the shortest period of time. That's what the 30 visit or the 24 visit, whatever you do, is just bring the best result in the shortest period of time. But from there on, you have to be upfront. You tell it has to be managed. And you have to tell the patient up front before the treatment starts. In my report of findings, they know all about supportive care. And they don't know even the cost of it right from the beginning. I said, as soon as we finish this treatment, what we're going to do next? And usually the question after that, they say, yeah, that's what I wanted to ask you. What happens afterwards? They want to know what happens after those 30 visits, 7 weeks, 8 weeks. And we tell them, this is not the end. This is just the start. And from there on, we're going to take you and taper you down. We're going to stop radically. All of a sudden, one day, we will start tapering it down. Skip 1 week, skip 2, skip 3, skip 4. And when you reach a level where you're handling it perfect, that's what the time would go. And I tell them, as soon as you do that, we usually do 14 visits for the whole year. The first time, I tell them the first time is not going to last the whole year. It's going to last maybe 6 months, 8 months, because we're going to taper down. But every one subsequent to that should last you a whole year. And I give them 14 visits because 12 once a month and 2 extra for vacations. And so it works perfect. When it comes to being able to do that, you have to let them know. We do 2-3 visits before the primary plan. That's when we give them the supportive care plan. They already know about it. We talked about it throughout the treatment protocols. When I see them, when I adjust them. But 3 visits before that, that's when we present the plan. And at the last reevaluation, we do an x-ray and we show it to them. And we ask them, bring the spouse to take a look at it. And they can see that. And before the end of each supportive care plan, the verse before the last one, that's when they get the next supportive care. They have a month to think about it. And most likely, they just come in, they sign right then, and they go pay. It's changing lives, telling the truth. You're not fibbing. You're not surprising them at the end of the treatment. You say, well, your cases are kind of hard, and we're going to have to add some more. No. I want my patient to know exactly what I'm planning ahead. And if they don't accept it, they don't accept it. It's not my job. My job is to present the truth, tell them the picture, and guess what? They know that. They're not dumb. Thank you.
Thank you.